Hi, this is Christina Larson. I'm going to be talking about the effects of alcohol abuse on the oral condition. Worldwide, alcohol is second only to caffeine when it comes to commonly used drugs. Alcohol is a toxic and psychoactive substance with dependence-producing properties. Alcohol consumption contributes to 3 million deaths each year globally. And alcohol is the leading risk factor for premature mortality and disability among those aged 15 to 49, accounting for 10% of all deaths in this age group. The World Health Organization reports that almost 2 billion people worldwide consume alcohol regularly, and almost 80 million are diagnosed with alcohol abuse disorders. The Centers for Disease Control defines excessive alcohol use as binge drinking, heavy drinking, any alcohol use by people under the age of the minimum legal drinking age, and any alcohol use by pregnant women, but explains that of those with excessive alcohol use, around 90% would not meet the criteria to be diagnosed with a severe alcohol use disorder. Many of us associate alcohol dependence with diseases of the liver, such as cirrhosis, but as healthcare professionals, we know that homeostasis is maintained in the body via organ systems that are interconnected and dependent on each other. Additional effects on oral health caused by alcohol abuse include xerostomia, decrease in effectiveness of drugs, dental caries, periodontal disease, and increased risk for oral cancer. Since alcohol is consumed orally, it can affect the oral health both directly and indirectly. Composition of alcoholic beverages combined with the frequency at which they are consumed are both factors that need to be considered. The glycoprotein lactoferrin is found in saliva and is part of the innate immune response of the body. Lactoferrin has antifungal, antiviral, antiparasitic, and bactericidal effects, which specifically inhibit bacteria from adhering to tooth surfaces. In patients with high alcohol consumption, it was found that there is a decrease in lactoferrin output, which may attribute to the increase in plaque levels reported, even though there were no significant differences found between alcoholic and non-alcoholic groups concerning their habits for oral care. Alcohol consumption causes dehydration, which can lead to xerostomia and reduced salivary flow. Saliva is crucial for keeping the oral pH in a range that is safe for the teeth to protect against the erosion of the enamel. In participants who were categorized as alcohol dependent, there was an observed lower, more acidic pH in their saliva, which can be an important factor in developing dental caries or cavities. The sugars in alcohol provide a hospitable environment for bacteria in the mouth, which can lead to halitosis, gingival inflammation, deep periodontal pocketing, and alveolar bone loss. When it comes to oral cancer, alcohol consumption is the most important risk factor due to the fact that it changes the permeability of the oral mucosa, which is attributed to its carcinogenesis. An inflammatory response can be triggered as alcohol breaks down into acetaldehyde, which can lead to the development of cancer cells. In the oral cavity, cancer is most commonly found on the lips or tongue, but can be present in any of the soft tissues. It's important that we're performing that intraoral, extraoral exam at each dental appointment so we can have the best chance of catching any abnormal lesions that may be developing on our patients. Some findings that may indicate that your patient is alcohol dependent would include an alcohol smell on their breath, rhinophemia, facial edema, jaundiced skin, facial redness, white tongue, hairy black tongue, halitosis, xerostomia, tremors, irregular pulse, and an increased blood pressure. The drying effects of alcohol can result in that white tongue, which is a condition that occurs when the papillae become inflamed and bacteria and dead cells become trapped within them, causing a white film to cover the surface of the tongue. The absence of saliva also means that the bacteria and food particles can settle around your teeth and they're not effectively washed away. Another important factor to consider is getting a complete medical history. Alcohol can have adverse reactions when combined with medications, so it's important to keep that health history updated, review it with your patient at each appointment. And even over-the-counter medications can cause side effects when combined with alcohol use. Alcohol and tobacco use are also commonly used together, which presents an opportunity to educate your patient on smoking cessation and drinking in moderation. So for our health history, when you're reviewing that, you might see a combination of some of these factors that can kind of start to point you towards maybe this patient is alcohol dependent. They may have a history of liver disease, vomiting, increase in blood pressure, smoking, pneumonia, tuberculosis, depression, oropharyngeal cancers, TMD, and even frequent accidents or falls. In our EO-IO, we would look for enlarged parotid salivary glands, a bluish color of face skin lesions, bilateral gynecomastia, tooth erosion, staining, and then white tongue, hairy black tongue, glossitis, and angular cheilitis, like we've seen. Educating the patient on the effects of their alcohol use on their oral health is really important so that they can start to understand the implications that are involved with heavy alcohol use and alcohol abuse. The dehydrating effect of alcohol can lead to xerostomia, which then creates an environment that can allow dental caries or cavities to form, and that can eventually lead to periodontal disease and gum disease, inflammation of the gums, and loss of alveolar bone. And as we know, there's a link between your oral health and your overall body health, the oral health systemic link. And so as they progress to periodontal disease, then that's going to increase their risk of having other serious health issues like heart disease. Luckily, alcohol consumption is a modifiable lifestyle choice. So educating our patient on the effects of these choices is going to help guide them in a way that they'll be able to make an informed and educated choice for themselves. It's a difficult conversation to have and should be initiated thoughtfully. Make sure you've built trust with your patient and you're at that point where you can have these conversations. But it is crucial that we're educating our alcohol-dependent patients on good oral care for their condition. We want to encourage the use of fluoride products to remineralize their teeth and protect against demineralization, demonstrate for them how to brush their teeth, encourage them to drink water while consuming alcohol to help maintain a healthy pH in their mouth, explain the importance of a nutritious diet, introduce products that promote salivary flow for them, such as those that contain xylitol, instruct the patient that they can use a straw when consuming acidic beverages like alcohol, and increase the recall frequency so we can monitor their periodontal condition. Lastly, again, we do want to consult and be in communication with their primary health care provider to ensure that we are doing our best to give this patient the best care possible for them. Thank you so much. Have a good night.